Welcome everyone. My name is Bob Benson. I'm the chair of the Integrated Joint Board on Health and Social Care, and I'd like to say thank you very much for those who are trying to persevere at the moment to get in. And just to add on to that is that maybe we should also be mindful as we move on that Storm Marwin's had quite an impact on connectivity issues. But I'm sure that Gordon will say something at some stage today that we do have a number of people who are still not connected to electricity supplies, and that will affect some people who are care at home. So our thoughts go out to them and to their families. And so I wanted to say that at the very beginning. I'd also like to welcome Maureen McCartney, who's here today. She's the only user reps who managed to get through so far. Maureen, you're now coming in as a full public partner member, so welcome. And I would also like to welcome Thomas Glenn, who's the new Chief Executive of Perth and Kinross. So welcome, Thomas. It's great to have you here. So before I move on to the agenda, I'd just like to briefly say thank you to Councillor Eric Drysdale for his management of the governance arrangements over the last 2 years. Eric has led to a whole lot of important decisions that we've been able to make, but also we've been able to conduct that in such a manner that people now feel that they are much more included and involved in decision making, and I greatly welcome that. And I would see that probably has been one of his legacies, if I may say that, Eric, and not embarrass you too much. So thank you very much indeed, Eric. And I'd now like to move on to the first agenda item, which is about declarations of interest. Scott, I should probably have said apologies as well. Do we have any definite apologies?
Good afternoon, members. Chair, we don't have any confirmed apologies for the meeting. Councillor Xander McDade, unfortunately, is running a bit late due to some connection issues and will be joining us. But I can pass to my colleague Adam to do a roll call of those in attendance, if you would like.
Yes, why not? I think that would be helpful for the new visitors. Thank you. I'll start off then. Are you going to go through it alphabetically, Scott?
Yeah, Chair, I'll just go down the list and just if people can just let me know that they're in the meeting, and we'll just move forward that way. Councillor Drysdale.
Just about present. Yes, present.
Thanks. Councillor Duff.
Present.
Councillor McDade. We know that Councillor McDade was having some difficulties, so I expect he'll join us shortly. Councillor Purvis.
Present.
Chair, we know that you're here, so we'll skip past you. Ronnie Erskine.
Yes, here. Hiya.
Beth Hamilton.
Yes, I'm present, thank you.
Pat Kilpatrick.
Yeah, present.
Gordon Patterson.
I'm here, Adam, thank you.
Jackie Pepper.
Present, thank you.
Jane Smith.
Present.
Sarah Dickey.
Adam, I think Sarah has intimated that she will probably join us in half an hour. She's a prior commitment. Thanks.
Okay, thanks. Dr. Sally Peterson. Don't think so. Dr. Lee Robertson.
Present.
Sandra Auld.
I'm present, and just to say that my colleague Ian McCartney will be joining us hopefully midway through the meeting.
Okay, thanks, Sandra. Lynn Blair.
Present, thanks.
Bernie Campbell. Lindsay Glover. Stuart Hope. Maureen Summers,
Present, thank you.
and Sandy Watts.
Present, thank you.
Thanks, Sandy. That's everyone then, Chair. Thanks.
Thank you very much, Adam. And now move on to 2, declarations of interest. Any declarations of interest, please? Okay then, let's move on to item 3, the minute of the meeting of the Perth and Kinross Integration Joint Board of the 29th of September 2021, and these are for approval. Can we have any comments on the accuracy of the minute, please? If there are no amendments or comments to the minute, I'd like to move to approve the minute. Can I have a proposer and a seconder, please?
Proposer, Pat Kilpatrick.
Thank you, Ms. Kilpatrick. Seconder.
Happy to second, Bob.
Thank you very much. Thank you. That now takes us on to the action points update. Scott, can you update us, please?
Chair, I think it might be Gordon that may lead on this item.
Okay, right, thank you.
Thanks. I was going to ask Jane to do it, but I'm happy to update that in relation to the development of a financial framework to underpin the Tayside mental health strategy. It remains the case that that work is underway, and there's nothing by way of any formal update that I can offer at this juncture, Chair. I appreciate that Chief Finance Officers, Director of Finance are continuing to do the work necessary to underpin to develop the financial framework that will underpin the strategy, and that will also be feeding into further work that is being advanced with greater focus and urgency across Tayside executive partners in terms of their oversight of progress against living life well. So hopefully that's helpful, but I appreciate that the IGB are looking for sight of a financial framework in order to formally approve and finally approve the strategy. Thank you very much.
Thank you very much indeed, Gordon. And that takes us on to item 5, any matters arising which aren't on the agenda. Okay then.
Sorry,
Right.
Chair, could I come in there?
Yes, please.
I was looking for my hands up facility, but I don't seem to have it, and I was a bit slow in the mic. So in terms of matters arising, can I just advise the IGB in relation to a discussion that we had at the last meeting that I would be very keen to provide an update. I had intimated that in the context of my report on mental health, that the rapid review, as it has been described, of the IGB's previous decision around the redesign of inpatient mental health services had progressed, and I had suggested that a number of different options had been considered in the context of the 4 workshops that took place under that rapid review. Councillor Purvis had very helpfully highlighted that that perhaps wasn't his understanding, and I was therefore then able to make some further inquiries and engage with the stakeholder participation group who are supporting this work. So indeed, Councillor Purvis is correct that the final option that was presented to the final of the 4 workshops was only in relation to the proposition that Carse View continued to be the main base for inpatient mental health services. I had suggested that a number of other options had been considered. Certainly members of the stakeholder participation group have confirmed to me that workshops 1, 2 and 3, a number of other options were considered, and they were very pleased that that consideration was being given. But ultimately, when the final workshop took place, I understand that the presentation and the scoring exercise that supported the rapid review only included the proposition that Carsview should continue as the main inpatient base for inpatient mental health. So absolutely, Councillor Purvis was right to highlight that information, and I'm grateful that he did. There were a range of options considered, but ultimately only one was brought forward, which I understand is a consequence of a determination that the factors that initially led to Perth and Kinross IJB determining that Carsview should be the preferred option, those factors still apply in terms of developing that idea of a centre of excellence in Dundee, the workforce challenges and the need to focus attention into one central location for inpatient beds. So whilst that's perhaps not a correction, it's an expansion of the information that was provided, and I think it's really important in light particularly of Councillor Purvis's challenge and intervention that I'm absolutely clear about the fact that, you know, these different options were considered, but ultimately consideration was only given to that final option. What I would say in addition to that is my understanding from the feedback that I've had from the stakeholder participation group is that they were not content with that approach in the fourth workshop and remain concerned about the proposition that Carsview should remain the location for inpatient mental health services. And their hope was that a short life working group, which was proposed at that time, would explore these issues further. That was the intention. That, I think, is still the intention. However, it hasn't been possible to initiate that short life working group since the departure of Kate Bell, who was, as colleagues will be aware, the interim director who was leading on this work. So I just want to provide that update to the IJB in light of the discussions that took place, and felt it probably most appropriate to do that as a matter arising. So thank you very much, Chair.
Thank you very much indeed. Councillor Purvis, I believe that you wish to come in on this item.
Thank you, Chair. Now I'll leave my camera off because my connection doesn't seem to be great today. Thank you very much, Chief Officer, for that update, and that's useful clarity. I would say, however, and I think I made this point at the last meeting, that I do find that quite disappointing, particularly given some of the recommendations that came through Strang, and the need to try and build trust with service users, carers, stakeholders, etc. And obviously you've articulated that they were not best pleased by the way that occurred. I would ask, Chair, perhaps if we could, while I know that the lines of responsibility are now somewhat different, if we could perhaps make representation to NHS Tayside to say that we would support that short life working group happening as soon as possible, to ensure that all of those who should be able to have an input in that process can do so. I think the issue here, just one final point, was that while we note that some of those problems that led to the IJB to take the decision in 2018 to have a central site remain, that I think that some of the concerns were about the central site being Carsview in particular, and I think that that is something that needs to be given due consideration. Thank you.
Yeah, thank you very much indeed. Your point is very well made, Councillor. Sandra Auld, are you wanting to come in this issue?
Yes, I do. Yes, I do, please. So thank you, and really just to concur with the point that Councillor Purvis has just made. My understanding is that there are colleagues who are taking forward the role previously held by Kate Bell, and it would be helpful if the short life working group really wasn't held up any further and could be taken forward. The gap in progressing this really it is of concern, because it's fundamental to improving the services moving forward, and also the implementation of David Strang's report. So I would ask that real consideration be given to moving this along rather than it being stagnated.
Thank you very much indeed. Gordon, both of these views seem eminently important for the Health and Social Care Partnership. How are you going to address this issue? Because clearly we can't wait until the next meeting before we get an update. How do you wish to progress this?
Thanks, Bob, and thank you for those comments. Those are very valid considerations and concerns. My intention would be to raise them directly with the Chief Executive of NHS Tayside and with the Director of Nursing, who is currently overseeing the inpatient mental health services in particular. And as I say, the focused work that the Tayside Executive Partners is progressing would suggest that this may give some impetus to some of the areas that haven't been progressed over the intervening period. So I shall raise it with them too.
Thank you very much. And Gordon, would it be possible to update us in the interim between the meetings, just so that we have some sense of the outcomes of some of those discussions?
Yes, certainly. I can do that offline, not waiting for the next meeting, Bob.
Could I just come in? I don't have an option to raise my hand. I've been in and tried to look for it, but so I don't know how I can actually come in unless I put something in the chat. But I would like to comment on the article that was in the press. I was away and didn't see it myself, but somebody sent it to me, and I just wondered if another press release could come out in view of what Gordon's just said to update the public and let them know what's actually happening and what the delay is, because people still ask me what's happening about Carsview. So I just wondered if we could have a press release to let people know what's actually happening, what the delay has been.
Can I suggest, Maureen, that we talk about this further to Gordon's discussions with the Chief Executive of NHS Tayside and with the Director of Nursing, and then we'll decide where we need to go with that. Unless there are any other comments on this particular action point, I now believe that Scott Henry has a further matter arising.
Yes, thanks, Chair. It was just to formally report in regards to membership, and you'd already alluded to this in your introduction, that in relation to section 6 of the minute of the previous meeting, the board had initially approved that both Ian McCartney and Maureen Summers be appointed as full members to the board. However, that was subject to ratification of both the Service User Reference Group and Carer's Voice. So it was just to confirm that approval took place and for recording in the minute of this meeting for a full record. Thanks.
Thank you very much indeed. And I now move on to a slight change to the agenda today. Jane Smith has to leave us for, I'm going to say, Jane, that you have an emergency dental appointment, and you're in some discomfort and you have no backup today. So I've agreed to move forward the finance budget update item to just now so that Jane can do this and then shoot off. Jane.
Thank you very much, Chair. I'm very grateful to you for allowing me to depart. Good afternoon, members. I am very pleased to provide an update today on the development of the Perth and Kinross Integration Joint Board budget for 2022 to 2025. This formal update follows on from the development session and the budget review group that we've had with IJB members to support their understanding of the detailed plans and assumptions that underpin the draft budget at this stage. The cornerstone of the budget, of course, is the strategic direction set out by service colleagues for the next 3 years, within the community health and wellbeing strategy being considered by the IJB today, along with the strategic development plans for older people and for learning disabilities, which are being brought forward to the IJB for approval in February. Significant investment across our services is planned. In particular, the scale of investment in older people services reflects not just our strategic ambition, but national ambition reflected in significant additional recurring funding coming from the Scottish Government in 22-23 to increase community capacity. However, as well as additional Scottish Government income, planned savings of £3.2 million underpin our proposed investment. These savings build on huge success over the past 4 years in delivering cash releasing efficiency savings for reinvestment across health and social care services. £13 million of savings over the past 4 years have been redirected to offset significant pay and price pressures and, importantly, to expand community-based health and social care services. Over and above this, through more efficient working, services have largely absorbed the increased demand resulting from a 7% increase in the over 75 population over the last 3 years. Wider than this, however, through redirecting our savings into investment in enhanced community-based services, we've made a significant stepped impact on preventing admissions, in reducing length of stay, and in minimising delayed discharge across the hospital system. The draft Older People Strategic Delivery Plan sets out our success, a reduction in occupied bed days over the last 3 years to March 2020 across large hospital set-aside specialties equivalent to 20 beds, a cost reduction of £2.3 million. However, we're delivering on the aims of the Strategic Commissioning Plan wholly through internal generation of efficiency savings, and moving forward, this can no longer be the answer. The scale of the further demographic growth and demand for services over the next 3 years means a far more fundamental level of additional investment required. The over 75 population in Perth and Kinross is expected to grow by a further 12% over the planning period, outstripping completely previous growth rates. Across our mental health services, the need for investment is largely expected to be able to be met by additional Scottish Government recovery and renewal funding. This has set out the financial framework for community mental health strategy being considered today. However, for older people, the scale of investment required is much more significant. Scottish Government funding for winter and resilience will assist greatly. However, at the heart of the Public Bodies Act is the intention to shift resources away from the acute hospital system towards prevention and community-based services in order to ensure the whole system can cope with the increased demand for services. The Scottish Government's medium-term financial plan, published pre-COVID, set out an expectation of significant shift of resources from the acute system to support health and social care partnerships and increasing their community capacity. The Scottish Government have, as recently as last month, confirmed such shifts in resources are still expected to be pursued and agreed by IJBs and NHS boards on top of additional winter funding, and the large hospital set-aside mechanism in the integration scheme provides the vehicle for agreeing such shifts. Determining the reduction in occupied bed days across large hospital set-aside specialties delivered from investing in our community-based services is the recognised basis for determining a quantum of appropriate shift. And in Tayside, that precedent exists, with a £1 million shift in resource from NHS Tayside to Dundee IJB, where such success in reducing occupied bed days could be evidenced. We believe we can now demonstrate similar success. Of course, we recognise the realities NHS Tayside face in being able to shift such resources in the face of rising demand generally for acute hospital care. However, I would ask IJB members, is it not incumbent on the IJB to pursue such a shift of resources nevertheless? How else do we ensure the necessary further step up in community health and social care services essential to deliver on the IJB's strategic objectives and to protect the unscheduled care bed base at current levels? This will undoubtedly be a challenging discussion with our partners. For learning disabilities, the landscape is different again. Whilst demand grows, this is not an area recognised by the Scottish Government for additional investment. We have tried hard over the last 5 years to manage within existing budgets, Within social care alone, over the last 4 years, 10% savings have been delivered across cross-learning disability services, with a further 5% planned over the lifetime of this draft budget. However, the extent of demand means net additional investment is now required, and this too is and will be a key discussion with our partners. It's worth noting that in moving to a care programme approach to budget setting, which IGB members will see is new for this year, we have unwound the £1.4 million health structural deficit back to its origins, which sit within prescribing and learning disabilities. The downside of redirecting our significant savings to invest in community services is that we've not been able to tackle the legacy funding issues inherited at inception. These therefore flow through to the budget requisition and will undoubtedly be a subject of significant and uncomfortable discussion with partners in the weeks ahead. We fully recognise the difficult financial outlook facing NHS Tayside and Perth and Kinross Council, and depending on the outcome of our budget negotiations, our ambitions may need to be paused, rephased or reprioritised. At this stage, we can't preempt the outcome of those discussions. We must also recognise that the draft budget is exactly that, draft, based on numerous key assumptions, and we await the December budget announcement from the Scottish Government with interest, particularly in relation to pay uplift in particular and uplift for social care services. Furthermore, our work on hosted services, primary care and prescribing continues, and there may be yet unknown material financial implications. There generally remain a large number of uncertainties, but I hope that in providing this interim update, IGB members feel assured that we are in the best possible position to engage effectively with partners in their budget setting processes and are complying fully with the requirements of us in terms of the integration scheme. We look forward to engaging with IGB members further in the new year to provide ongoing updates, to set out the full 3-year plan, and as necessary to bring forward the difficult options that may need to be considered in order to deliver a balanced financial plan. I'm very happy to take any questions, both in the detail of the paper provided on any of the strategic commentary that I've provided this afternoon.
Thank you very much, and thank you very much indeed, Jane. And as people can see, that is that if they want to put a Q or a C in the chat box, then please do so now. Ronnie Erskine.
Thank you, Bob, and thanks very much, Jane, for that. It's very helpful to hear the comments on the draft. I think significant uncertainties with some of the wording used in the paper, and it's almost like with the uncertainty around the government position and also the partners' positions, it's going to be difficult to get any certainty, I suspect, until nearer to the year end. But I appreciate that you have to try and set out what is the best approach. I had 3 questions that I wanted to ask, really. The first was around, it's mentioned in the paper, I think in paragraph 3.5 and 4.2 separately, that there have been or will be discussions taking place on the £1 million request that you talked about earlier for older people services. And maybe other relevant issues, I think in particular on the NHS side. I wondered if those meetings have taken place or if there's anything that can be mentioned as an outcome of those discussions. That was my first question. A second question on, there's a point in the paper around reserves in 3.9, 2% reserves. I just wondered if you could give me some information on when we last reviewed that and when we're likely to be reviewing it. You know, is that still an appropriate figure to hold? And my third question related more to the kind of lengthy discussions we had around the budget at the year end last year. And one of the discussions that took place, there was perhaps a hope expressed that there could be further savings proposals examined following the settlement or the setting of the budget at the start of April, end of March. I just wondered if you could tell us what work to try and identify savings took place from April up to now, and whether there have been any successes there. Sorry, I have got a fourth question. I'm sorry, Bob. There's a lot of questions. This is quite important. I think you mentioned Dundee had succeeded in gaining some additional funds last year, I think. I wondered if you were able to share with us any of the evidence or the basis for your view that PK is in the same position or a very similar position, because that would obviously add a bit of weight to negotiations on funding through a large hospital set aside. Sorry it's so many questions, Jane, and I can see you're not exactly in the best of shape in terms of your dental, so hopefully they're not too painful.
Oh, thank you very much. Thank you very much, Ronnie and Jane. And in your time, if you want to just methodically go through those questions, please.
Thank you, Chair, and thank you, Ronnie, for your questions. First of all, in relation to the engagement with our partners and their budget setting processes, I know your question was in relation to NHS Tayside specifically, but I think I would take the time to provide assurance that we are fully engaged in the budget process in relation to PKC, and are fully engaged and supporting a range of discussions with Perth and Kinross Council, Executive Officer team and elected members. As we've discussed before, the budget setting process of the partners is very different. So we have been very proactive in seeking to establish a route for discussing the budget with NHS Tayside. Unfortunately, a planned meeting last week had to be delayed, but that has been rescheduled, and we look forward to detailed negotiations and discussions and ensuring a better collective understanding of respective positions in the weeks ahead. My hope, and I hope members would recognise this, that in bringing forward an indicative position in the way that we have, very much supports those discussions and is seen as proactive and positive, rather than seen as raising expectation unnecessarily. Certainly that is not the intention, but we have an obligation on behalf of the IJB to set out our requirements and then to engage in those budget discussions, and we've been very proactive in setting out a schedule of meetings to do exactly that. So that would answer the first question, hopefully, Ronnie. In relation to reserves, I would absolutely acknowledge that our reserves policy was set at inception, so that is a number of years ago now, and it is my intention to bring forward a review of that reserves policy to the IJB at the March meeting to allow IJB members to consider the sufficiency or otherwise of the current strategy. So that is in the plan, Ronnie, but thank you for allowing me to bring that to the attention of members. You have quite rightly raised the challenge around savings, and I hope that as part of the strategic commentary that I've provided to members today, it gives them a sense of the scale of savings that have been achieved over the lifetime of the IJB, and the need for all of those savings to be redirected into community-based service enhancement, because we have had no other significant investment to do so. Of course, that drive to deliver savings to invest in community-based services leaves us, in our view, with significantly less opportunity now to deliver on enhancing services through efficiency and through savings. The financial plan before you today, however, does include, as I said, £3.2 million of additional savings. We continue to work on that, particularly in relation to prescribing, to primary care and to hosted services, and we do consider that savings target for us will go up. But we can't ignore the level of efficiency driven out of the system over the last 5 years, and how little left there is to give. Gordon may want to comment on the benchmarking that we've done, and certainly that's something that we can share out with this meeting with members in terms of making sure that there's no stone left unturned. In relation to your final question and our learning from Dundee's success in securing a shifting the balance investment of £1 million, that absolutely is part of the learning that we want to do to ensure that our case is strong. But the occupied bed day information that we are basing this on comes directly from our partners. It forms part of the annual review of the large hospital set-aside budget. It is a fact, and we can show quite categorically that what we have achieved, and that comes from a formal review of the large hospital set-aside annually as part of the large hospital set-aside budget calculation. And that is the way it is supposed to work. That is the way across the system it is expected that we measure our success retrospectively and seek investment, a shift in investment prospectively. And I hope that members will support our desire to set that case out and ensure that we can invest strongly and provide the capacity needed for the years ahead.
Thank you, Jane. Gordon, Jane invited you to make comment on savings proposals. Do you wish to say something just now?
Thanks, Bob. No, I think Jane has clearly outlined the fact that we have delivered significant savings over the period of the Health and Social Care Partnership, and that we have reinvested those into seeking to try to deliver a much more comprehensive and robust range of community services to secure actions to deliver on the IGB's strategic priorities. So we've been looking at how we can support people to remain at home for as long as possible, to remain independent, to remain healthy, and in doing so to take pressure off other parts of the system. I probably wouldn't want to get into any more detail, but if there's any questions about any of that, we can certainly cover them off.
Okay then, and in the absence of that, I'm going to ask Patricia Kilpatrick.
Sorry, Bob, could I come back on a couple of those points, please?
If they're immediately prescient, yeah.
I don't think they're prescient, but it was two very brief points. It was just to welcome all of Jane's commentary, which I think gives a high degree of assurance that the process that we're following is one that will lead to a rigorous budget when we get to March. The point about the large hospital set aside for me was certainly I would expect the IJB to support that, but that would require comparable evidence to be shown that was similar to the situation in Dundee. And finally, the savings question asked really related to since April 2021, what we had generated in terms of ideas. I appreciate we've done a huge amount over the last few years, and that's certainly welcome and acknowledged. Thank you, and thanks, Bob.
Okay, thank you very much. I'd like to bring in Patricia Kilpatrick, please.
Hi, Bob, and thank you for your paper, Jane. It was very well laid out, and I think it was very good from the point of view of not being a finance person. If I could just go back to the point that you made before about the large hospital set aside, have we actually we've actually identified that we've saved the equivalent of £1 million in reducing occupied bed days, or is that what we need to deliver the older people strategy, £1 million, and we've reduced some occupied bed days and we're on the way to, do you know what I mean? Is it a cost reduction in process projecting £1 million saving, or have we actually demonstrated? Because I think from memory from the board papers that Dundee got the money retrospectively as well. So just wondered what the situation is. Is it an actual, or is it projected? And does it equate to £1 million, or is it £1 million we need to deliver the older people strategy?
Jane.
Yep, thank you, Pat. It is actual. It's a look over the last, and it's pre-pandemic, so we are not seeking to take the benefit of the huge flux in the system caused by the pandemic, both the ups and the downs. So it's pre-pandemic, looking at the last 3 years, looking at the significant reduction in the level of occupied bed days across large hospital specialties that is driven and supported by our work to enhance community-based integrated services, and that is the evidence that we would seek to present. And you know, we feel we're bringing it forward at an early enough stage that we can perhaps influence the budget decisions of the board, so that it is retrospective, but we need it prospectively to support further investment.
That's great. Thanks, Jane, that clarified that point. Yeah, thank you.
Thank you very much indeed. Let's see, is that Councillor Purvis has just gone? Do you want to make a comment, Councillor Purvis?
Yeah, if there are no further questions, then, and I'll just make that now if that's okay. Just wanted to very much welcome this paper. I know an awful lot of work has gone into it by Jane, Donna, and the finance team, particularly given the other things they've been having to deal with at the same time. I think it's really positive that we're now seeing this proposal coming forward in relation to the large hospital set aside. It's something that not just we've struggled with, but that IGBs have struggled with across the whole of the country. And if we're really serious about shifting the balance, then it's absolutely something that we need to do, to look at disinvesting there in order to release more money to spend in the community. So I think that's a very positive proposal. We can evidence it, we can demonstrate how it is that that amount of money is what we require. So I hope that NHS Tayside will look on that favourably. Just to mention to everyone, clearly we have the budget review group ongoing. We've had our first meeting of that. That has now been extended to not just the voting members, but to all members of the IGB. So you're all more than welcome to attend. I think our next meeting is on the 19th of January. So if you do wish to come along to that, and you'll be able to ask even more questions, and hopefully get to a position where we are in agreement with what we're putting forward when it comes to the budget setting in advance of the year end. So just to say, very much welcome the paper, and look forward to continuing to engage on the budget over the next few months.
Thank you. Are there any more questions or comments? If not, we'll move to note this report and the updates on the budget itself. Thanks very much indeed, Jane, and thanks very much for the quality of the questions as well. Thank you very much indeed. I also welcome Councillor McDade to the meeting too. Welcome. Okay then, thank you, Jane. You can stand now and rush off to your appointment. Okay then, that now takes us to our delivering on strategic objectives, item 6, and we now move on to the substantive document on the draft community mental health and wellbeing strategy 22 to 25. We had an excellent presentation at the development session, as you know, and there are lots of good questions raised there. I think I've asked the Chief Officer that we, given there's a high level of information in the paper, that we won't need a very long presentation on this. And I now pass it over to the presenter. Gordon, is there anything you want to say to preface this?
Chair, no, I'm very grateful to you for doing so. I was just going to acknowledge the fact that we have had a very positive development session. I particularly, though, would want to extend thanks to Chris Lamont, who's going to present on this, for the work that he and colleagues have been doing with our mental health strategy group to arrive at the position where we're able to present this draft strategy for IGB consideration and hopefully approval today. So I'll pass over to Chris, and he'll speak to the report and introduce the item. Thanks, Chris.
Thank you, Gordon, and thank you, Chair. So I will literally only be 5-10 minutes at a max regarding this, because I know that I've spoken to many of you over the past few weeks, and you're probably sick to the back teeth of looking at my face.
It's so They asked for 7, so there it is.
Oh, there you go then, that's fine, I'll time myself. So this is obviously just looking at the community mental health and wellbeing strategy for Perth and Kinross, which we've been developing over the last 22 months. This followed a period of significant consultation and engagement whereby we managed to access and get the views of approximately 300 people from across communities in P&K. That then ensured that we were able to take cognizance of what their thoughts, their feelings were, where they wanted to see the direction of mental health within Perth and Kinross, but at the same time we had to take into effect what the findings of the Trust and Respect report were and Living Life Well. So that's really how we've now managed to reach the point of what we're presenting today in draft form. We've identified 5 key themes which cover early intervention and prevention, which is under Good Mental Health for All, access to services, coordinated working and person-centred care, participation and engagement, and obviously a review of workforce resources and what we require to look at over the next 3 years of this proposal. The draft strategy has been presented to several different forums over the last 22 months, including IMT, the Strategic Planning Group, EMT, as well as on a regular basis to the Mental Health and Wellbeing Strategy Group, which will be the overarching and overseeing group throughout the life of this strategy. The action plan that's also contained within the strategy looks at all 5 key themes in significant context, and underneath the action plan we have now developed 5 key working groups who will monitor and support the progress of the actions on a regular basis, and they will then feed back into the Mental Health and Wellbeing Strategy Group. We will ensure that there is regular feedback into EMT and IGB in regards to progress of the strategy, and we're currently having discussions and focus now on developing performance indicators as part of our performance framework, and that will also come back into the EMT so that everybody can be fully aware of what progress we are making from a strategic perspective. Within the IGB paper, which has also been submitted, there is a direction that this will also be shared and look for feedback from both PKC and from NHS Tayside, but more from a perspective of this is what we are aiming to deliver and how can we ensure that this ties in with everything else that is happening in context. So that's well beyond the 7 minutes, Chair. That's probably enough information at this moment in time, but I'm more than happy to answer any questions.
Thank you so much. Sorry to put you under so much pressure. Okay, we're ready now to receive questions and comments, and we also welcome Sarah Dickey to the meeting. Pat Kilpatrick.
Good afternoon, Chris. So is this part of the agenda, are we taking the whole thing, mental health and the strategy, are we taking all the papers together, Bob, about residential rehabilitation and rehab placements? Is that all forming one item on this agenda, or am I out of sync?
Yes, that is, as I understand it, and there are a series of recommendations that I'll ask you to approve or otherwise at the end of the meeting.
Okay, I've got a number of questions, Chris, and I found the papers very interesting and very helpful, and well done for all the work. And I think I've said that to you at a previous meeting. I think it's really a great step forward for us. A couple of things were in 3.15 of your submission back to Scottish Government, I think it is, about what services you have and the progress you've made around substance abuse and mental health. It says there are no joint protocols between there are no joint protocols between drug services and mental health services. No formal arrangements or joint assessments are in place. And then you talk about a prototype pathway being developed in 2021. Is that right?
So, sorry, can I just come in? Sorry to interrupt, but I think it is really important that we draw a distinction between item 6.1, which is the draft community mental health and wellbeing strategy.
Yeah, that's what I was asking, Gordon, whether we wanted, were we including the appendixes to that at this stage?
Right, so Chris is able to speak to the draft community mental health and wellbeing strategy. The next item is the community custody unit, which Evelyn will speak to. But the item pertaining to the redesign of substance misuse services is 6.3, and that's a separate item that Kenny Ogilvie will speak to.
Right, that's good.
But
okay.
I absolutely recognise the importance of drawing those clear links between alcohol and drugs and mental health part, but these are, for today's purposes, separate items.
They are, but in your strategy, Chris, right, and that was the point. That's why we're not quite in silos, but in your strategy, Chris, right, and this is a personal question about what you think. Do you think that in the strategy we are tackling the joint pathway, if you like, for, because according to Kenny Ogilvie's, we're not, the joint pathway because of the people who present with mental health? Well, they say that 70% of people who have a substance abuse problem, issue, whatever you want to call it, illness, disease, right, that 70% of those people also have a mental health issue. That's been recorded, and it was in the Strang report that was shared with the board in 2019, all of that. So do you feel that in the mental health strategy, which is the right point of the agenda, that we haven't got a joint pathway, but are we addressing that issue, or do people still turn up and say, I can't sort out your mental health problem till I sort out your substance abuse problem? Or are we holistically saying you've got a substance abuse problem, but that's partly because you've got a mental problem, so we'll treat you as one single patient holistically, as a whole person, and not treat you by your disease? Otherwise, it's a bit like turning up at orthopaedics and saying, we're not going to replace your hip because you've got a heart problem. Once you've had your heart problem fixed, come back now and I'll replace your hip. Is that a fair question, Chris?
Yeah, Pat, if I may, could we use the language of substance use, please?
Yep, sure.
So in answer to your question, Pat, we are aiming to address that within the strategy through one of the actions within the action plan. But at this moment in time, I would agree with what Kenny's paper is saying, which there is a definite disconnect. And if I can just embellish that slightly, I actually had a meeting yesterday with Rachel King from HIS, who are looking at doing some work around pulling together these key pathways, which again were identified within the Strang report, and they are hoping to start looking at the 3 partnerships across Tayside and doing some joint work around that. So there's going to be a meeting arranged in the new year where all of the ADP leads, all of the lead clinicians, and the people that can actually make some changes from a service user perspective come together, and we can start actually looking at how we can make that work. But as going specifically to this mental health and wellbeing strategy, there is actually a key point within there around how we want to start making substance misuse or substance use services and mental health services work more collaboratively, given the fact that we have registered and qualified mental health practitioners and clinicians working across both services.
Can I come back to you? I think that's great, Chris, and I am totally I totally accept what you're saying, and that there is a commitment to do that. I do think, Chair, that it's disappointing that the Strang report published in 2019 flagged this up, and we're sitting here nearly in 2022 and we haven't addressed that. And our increasing numbers of drug-related deaths and substance use patients continue to increase. And I do think that's extremely disappointing, but it's no reflection on Chris or his strategy. Thanks, Chris.
Thanks very much indeed, Pat. Your points are well made. Beth Hamilton.
Thank you, Bob, and I'm pleased to hear the discussion there. As you know, Chris, the joint substance misuse, etc., has been in my interest as well, so I'm glad to hear your comments. I just wanted to come in. I've heard it now a couple of times, and I think I've given some feedback at other forums, but I just wanted to formally in this forum congratulate you on the strategy. I think I've said before, and I'll say it again, you've covered all of the issues that I had hoped it would be covered, and I would want to particularly commend you on the all ages aspect of the strategy and working across the boundaries. So just to say well done, and I look forward to hearing how it all progresses.
Thank you very much, Beth.
Okay, Maureen Summers.
Yes, I'm just agreeing with what Pat's highlighting here. I mean, it's a chicken and egg scenario. You know, what comes first? The mental health turns them to drugs, or the drugs causes the mental health. But the two are, you know, completely linked to each other. Like, you know, and I'm really pleased that this is happening. But as Pat says, we've been talking about this for years, and that, you know, that most drug abusers now have some sort of mental health issues, and unless, you know, they look at the person as a whole and go into the reasons why different things are happening in their lives, then we're not going to get a proper answer, and there are going to be more deaths through suicide and overdoses, and it's tragic, really. So could I just clarify that you say that Kenny's coming on to talk about the mental health, sorry, the drug and alcohol. Are we going to be linking the two together, or are we progressing two separate strategies here? And the second thing I would like to say is, I do hope that this is going to be the strategy, if it's passed today, will be a living document, and you know, that there will be, you know, updates and changes to us as we go through the life of the strategy.
Thank you very much indeed, Maureen. Do you wish to address that question?
It's really just to say I totally agree with you, Maureen, and as part of the Mental Health and Wellbeing Strategy Group, I hope that you will be part of this as well.
Okay, thank you very much indeed. And I think that point about joined up strategies is a key point in this, given that we do have holistic approaches to things. Now I have a comment from Councillor Drysdale, and then followed by Kenny Ogilvie. Eric, do you want me to continue to the next person, then come back to you, if that's okay?
I can hear you now, Bob. Sorry, as soon as I switched on my camera, I lost.
Okay.
I hope you can hear me okay.
I can clearly.
I just had a comment I wanted to make. I made it in the development section of this paper, was it a week ago or 10 days ago? And I just wanted to say again how much I appreciate the work that's gone into this paper, and thank Chris for the enormous, and his colleagues for the enormous amount of work that's gone into it. And for myself, after 4.5 years on the Integration Joint Board, I now actually feel much more confident that we're absolutely heading in the right direction. Thank you.
Thank you very much. Well said, Eric. Kenny Ogilvie, you have a comment, please.
Oh, sorry, I'll jump in. I mean, obviously, myself and my co-presenter for the substance use strategy, Charlie Cramner, can talk in more detail later on, but it's just to provide assurance that, you know, we are certainly working very hard to improve the coordination between mental health and substance use services. And in terms of the strategies being joined up, I mean, Chris sits on the ADP, and also I'm involved in certainly the Action 15 group. And we do have certainly colleagues, our service manager responsible for the mental health officers sits in the mental health strategy group as well. So, you know, we do have strong links there, and all the care group strategies are overseen by EMT and also our SPG, as well as obviously the IGB as well. So yes, the two strategies are interlinked, and people are aware of the various developments going on, and they are certainly joined up and coordinated as much as possible.
Thank you very much indeed. Are there any other questions or comments, please? I have Ronnie Erskine wants to ask a question.
Thank you, Bob, and thanks for the paper. And it's very helpful sometimes to see something more than once, and when you go away and read it again as if you'd never seen it, things can pop into your head, which is what happened to me when I read this paper, actually. There's a huge amount of information in it and an awful lot of detailed actions. Obviously, it's quite operational, and that got me thinking about the role of the IJB, which is strategic leadership. And when you go back to page 16 on the paper, section 2, why is mental health and mental well-being important? The first paragraph in there defines, the WHO defines mental health as a state of well-being in which everyone realises their abilities. It's about coping, but it's about productively and fruitfully working and making a contribution. When I read the paper in its entirety, it does seem to me very effectively to address the actions we need to take to address ill health. What I'm not seeing so much perhaps in the paper is some maybe more visionary leadership on the positive, life affirming side of using those in the community that are perhaps mentally a little bit more able than others to inspire and bring other people along. Sometimes I feel when we talk about the challenges and the difficulties as much as we do, it seems like that's all we're focusing on, whereas we could actually be inspiring and enthusing at the same time. So it got me onto my question or request actually for an action to be considered in the strategy, which is one which would measure well-being across Perth and Kinross, attempt to measure it using presumably an annual survey, a random sample of our population. Otherwise, we have so many priorities in here and so many things that we need to do, and Jane talked earlier about the financial constraints we're under. How do we really know what is more important than something else? And we certainly can't do everything, but it would help us to have some form of evidence base to allow us to make a decision, I think, on what to prioritise. So I suppose I've two requests or asks, if you like. One is that we consider some resource being applied to positively uplift and encourage a community-led sort of inspiring mental well-being agenda, rather than dealing with some of the challenges we face. And secondly, that we use as a core metric to measure our success year on year a well-being survey that would start to identify whether we actually were doing better or than we think we are. Has the plan worked, in other words? I hope that makes sense and it's not too esoteric, but I tried. And when I read the paper, I thought it was the strategic overlayering that was what jumped to my mind. Thanks, thanks all.
Thank you very much. Gordon, you may wish to come in to respond to this question as well, if you wish.
Thanks, Bob. Yeah, I absolutely accept Ronnie's points, and I think they're highly valid. I think probably what we need to do is to reflect on what existing measures and approaches are in place that enable us to determine whether or not mental health and well-being is improved. We would be drawing down a number of performance measures in relation to the actions in the strategy, but there are probably broader things that we need to consider, as Ronnie suggested. There is obviously the regular health and well-being, health and care survey that's produced by the Scottish Government, and that gives some nod to the extent to which people are feeling supported, etc. I think Chris might also want to say something about, in terms of inspiring mental health and well-being, probably it may well be in the strategy, or it may well not have been amplified as well enough by the strategy, that we are doing a lot of community engagement, community work, and providing a lot of funding to the third sector in order that they can support people in a more preventative, early intervention way to remain well, to remain connected, and to provide supports that statutory services need not provide because we commission it from other bodies. There's a broader question though around community engagement and community capacity, and we do have an ambition within the partnership to look at the opportunities for doing some health promotion, population health analysis that is probably more general than just in terms of mental health, but would be a component part, I think, of what it is that Ronnie's commending to us, which I think we need to reflect on. And Chris, you may want to add to that response. And I see Evelyn's put something in the chat that I'll just have a look at just now. Chris?
Thanks, Gordon. So yeah, you're quite right. We've invested a significant amount of money into other organisations around capacity, mental health and wellbeing since April 2020 to the tune of round about an additional £1.1 million. And that's come from a variety of different funding streams, including Action 15 and the Mental Health Outcome Framework and remobilisation money, which the partnership have made available. So that has been focusing upon community resilience. It's been looking at trying to attract different organisations from a third sector perspective to try just look differently at what they want to deliver and how that will benefit individuals out with the norm of mental illness and mental ill health. The other thing that just to flag up is the NUC, which many people on the call will be familiar with, obviously has a significant amount of input just now into what we are trying to deliver. The manager of the NUC is actually the vice chair of the Mental Health and Wellbeing Strategy Group as well, but they are looking at increasing their peer support. And again, that isn't just from people with mental illness, that's looking at it from a more holistic mental health and wellbeing perspective. But I do take on board, Ronnie, what you're saying around some ability to try and measure what our well-being is like across P&K. And I can certainly have a conversation with our business team and see how we could maybe try and put something in place around that.
Okay, thank you very much. Councillor Purvis, a question followed by Jackie Pepper with a comment.
Thank you, Chair. A couple of questions, if I may, and thank you very much, Chris, for the report and also for the briefing last week, which was very helpful. My first question was on the third sector. Now, it's very positive to see the third and independent sector that there's a very strong role for them within this strategy document, and certainly, you know, I know from engaging with lots of these different organisations and voluntary groups that they can do an awful lot of good work, and sometimes for less money than we would do commissioning the services ourselves. But it's just on that point of financing. I'm just wondering now, I see the sort of headlines in terms of the amount of money that's being put into community support. Do we think this is sufficient in order to shift more of our services into the third sector? And if it isn't, or how will we review that going forward? Because they are very good at doing that, but I know that sometimes there is a concern that they don't have the full funding in order to deliver the expectations that we might be putting on them. Sorry, that was a very long-winded question.
So there's been additional money that's been made available by the Scottish Government, which has gone out to every health and social care partnership, third sector interface group, and we've obviously received a significant amount of money from a Perth and Kinross perspective, and I sit on that group, which is in its infancy at this moment in time. And just yesterday there was communication that went out to all third sector organisations around how they could apply for that funding. I suppose the simple answer, Councillor Purvis, is there's never enough money. The more money that you can offer always generates more ideas, and then there's always a scramble around for everybody trying to prioritise. The biggest issue that we find, and this is fed back regularly from third sector, is the fact that the monies that are made available from Scottish Government are usually only 1 year at a time, and therefore it restricts the volume of their planning ability in the longer term. So from that perspective, with the Action 15 monies, which we oversee and I chair that meeting, we've been trying to ensure that the longevity of various projects and various ideas has been sustainable, because we knew initially that Action 15 was going to be around for at least 4 years, and we are hoping, although we haven't received anything yet from Scottish Government, we are hoping that it's going to be continued funding in the longer term. So that's certainly one of the funding streams that we're hoping that we can ensure that third sector organisations are receiving that long-standing funding.
Okay, thank you for that, Chris. And my second question, I think, builds on some of the questions that Mr. Erskine was asking around the reporting and reviewing of the document going forward. And he talked about the measure of well-being, and I know that Mrs. Kilpatrick has noted about the reporting of performance indicators on mental health to the IGB. I suppose one of the very positive things that I remember from the Living Life Well document and some of the things that Kate Bell said was that it was very much considered a living document, and I assume that that's the same case in relation to our community mental health strategy. I'm just wondering if you could perhaps flesh out a bit more. I know that there's a table in the document about how things will be reviewed in relation to the key themes, but if we have actions that are not working, what's the process for reviewing those and implementing different ones to ensure that we are actually meeting our targets? Because we might not be meeting the actions, but sometimes the actions that we've suggested might not be the right ones in the first place, if that makes sense.
Absolutely, and I'm more than happy to answer that. So I chair the Mental Health and Wellbeing Strategy Group, which has approximately about 35 members that attend. It's I would say about 2/3 third sector, 1/3 statutory service membership. We have all agreed collectively that we are going to subdivide down the subgroup, the strategy group, into 5 subgroups. Each subgroup will concentrate upon one of the key themes within the action plan, and they will meet on a regular basis and oversee the actions that are taking place within there, get updates, monitor progress, and see where there's any problems that we need to overcome. From that point, they will then feed that back into the Mental Health and Wellbeing Strategy Group, where collectively everybody can then have some ideas as to how we can unblock any of the issues or where it then needs to be escalated. From there, if we feel that collectively as a strategy group we cannot overcome the issues that we're discovering, I will then personally take that through formal request into EMT so that then we can try and get a strategic layer of decisions and ideas and expertise to try and overcome those issues. On a regular basis, I'll be feeding back into EMT anyway, and I would imagine that there will be requests coming from IGB where updates around the progress of the strategy will be delivered here as well.
Thanks, Chris.
Thank you very much. And is there a further question, Councillor Purvis?
No, sorry, Chair. I was just saying thank you to you as well.
All right, thank you. I'll now go on to comment from Jackie Pepper.
Thank you very much, Chair. It was really just to pick up on Ronnie's point about community wellbeing, and we had a briefing for elected members and members of IGB this morning in relation to the work that we're taking forward for children and young people's mental health and wellbeing, and a similar point was raised there in response to what young people say, that what's important to them is friendships and relationships and actually speaking to others and peer support. And there was a question raised about how are we engaging with the wider community, volunteers, etc., to be able to respond to some of that and wrap around people's distress or need for support. So I think there, Ronnie, that there is raising a similar point about what's important for individual well-being, but family well-being and community well-being. And I think you raise a really important point there about that needs to be the fundamental focus of actually supporting folk to feel well, and moving away from that focus on mental ill health and specialist services. So there was a similar discussion this morning, and I think that is something that we can work together on.
Thank you very much indeed, and Jackie, I also attended that session as well, and if there's an opportunity for IJB members who weren't able to see that session, I believe that was a recorded event, so perhaps Secretariat can give us an update on that if we could get that for members. It was a really important presentation and I thoroughly enjoyed it. Thank you very much indeed. That then takes us now on to the recommendations, and there are 2 recommendations: that the IGB consider and approve the attached community mental health and wellbeing strategy, and the second recommendation is that, following approval above, ask the Chief Officer to issue the necessary directions to both NHS Tayside and Perth and Kinross Council make the necessary arrangements to deliver services to implement the actions in the Perth and Kinross Health and Social Care Partnerships Community Mental Health and Wellbeing Strategy 2022 to 25. Do we support these recommendations?
Agreed.
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 Yes.
Yeah.
Thank you very much. I'll take that as approval on both of these items. Thank you very much indeed. And thank you very much, Chris, for your input into this and for the excellent development session we had and your excellent response to today's questions. Thank you very much indeed. Gordon, I'm now going to move to the community custody unit, and then after that we'll pause for a break before we move into substance use services. Okay, Gordon, over to you. Number 6.2 on your agenda.
Thanks, Chair. This is one of those IJBs that I had been seeking to achieve, where colleagues in my executive management team are speaking much more on those items than myself. And I think that's really helpful in the context of their ownership of some of the papers and services that we're bringing forward, but also in terms of their profile. I would just want to introduce Evelyn, who's going to speak to this paper, and similarly, Kenny Ogilvie will speak to the subsequent paper. But note that you're wanting to take a break. So Evelyn, I'll hand over to you in relation to the female custody. Thanks very much.
Okay, thanks, Gordon and Chair. So the purpose of this report is to update the IJB on the development of the female custody unit in Dundee. And it is a development that has been led by the Scottish Prison Service and supported by Scottish Government. Part and parcel of discussing the paper here today is the delivery of healthcare and the expectation of the delivery of healthcare within the female custody unit. So you'll see from the report that it's a proposed 16-bedded unit constructed at the Coleside, Dundee, for convicted female offenders. The ask of the IGB today is to note the date for the opening of the CC unit, which has been deferred to June 2022. And to note the work that we are ongoing in terms of securing funding from Scottish Government to provide healthcare within the female custody unit. So the unit has been in the planning since 2018. It's gone through the Planning Committee of Dundee City Council, who have approved the SPS application to build the female community custody unit, and supported obviously by Scottish Government. The purpose of the unit is to support a combination of women's needs within the unit and varying levels of support. So with the 16 placements within the unit, there will be a need to have unescorted access to healthcare within the community, which will be predominantly in Dundee. There will be escorted access to healthcare within the community. And then there will be women in the unit who will not be able to access healthcare within the unit, and that's where we will need to provide more support. The CC unit will be, as much as possible, supporting the integration within community and to support women to progress quickly through the unit to go home. It presents an opportunity to enable women to recover and build on links within the community and support to re-enter into the community. So based on our experience, as you know, we host prison healthcare for Tayside, and based on our experience of managing prison healthcare, we have designed a workforce delivery model, which is proposed in the paper, in the appendices. We are proposing a blended model within our current staffing models for HMP Perth and Castle Huntly. So it will be a blended model across the 3 sites. You can see the cost delivery of the model there sitting around 462,000. So in conclusion, really, we just need to continue to work with Scottish Government in seeking assurance for recurring funding. It is now going into their budget setting process as well. and we need to work towards staffing the Bella Centre from early next year, really, to work on the staffing model. So that's as much as I really need to say. I think people hopefully had an opportunity to read the paper.
Okay then, thank you very much, Evelyn. And I have a question from Beth Hamilton.
Good afternoon, Evelyn. Thanks for that paper. It was just a quick question. Obviously, with it being women's health, I was just wondering what the pathways are being developed with Conton Vale, or are there more generic pathways? But I know there'll be a lot of work required with Conton Vale.
Yeah, I have Angela Cunningham here, the service manager who's leading on it, and she may be able to just answer that question if I can bring her in.
Thank you.
Yeah, thank you, Evelyn. The SPS management of the services, actually, it's been led by Conton Vale rather than being locally, because it's coming through the Women's Strategy Group. We are working very closely with them and with the Glasgow group that are developing a further community custody unit. In fact, I have a meeting after this one to speak about their OT provision and the OT provision in Conton Vale. So they're very closely linked. All the women that come to the centre in Dundee will have been in an assessment unit, either in Dundee or up in Grampian.
That's great, thanks. I'm assured that you're working closely with them. Thank you.
Okay then, comment, actually, Pat, I'll take a question from Sandy Watts first, and then from Councillor Purvis, and I'll come to you.
Thank you, Chair. The Third Sector Forum discussed this at some length yesterday at our meeting, and we're very grateful for the paper, which was very concise and clear. One of the issues that was discussed was that many third sector organisations already work with people within the criminal justice system and work within the prisons. And we wondered if there would be opportunities for third sector to be involved in any discussions about the design and delivery of services going forward, as we feel that there's a strong contribution from the third sector to be made. Thank you.
Yeah, we have third sector represented on our health and social care subgroup, and Shine are representing a lot of third sector organisations nationally, and also sitting on the project board, which is chaired by Dundee Partnership. We do have links already with local partnerships and local third sector partnerships, and absolutely it'll be SPS that are doing any commissioning when it comes to any commissioning of third sector input, but certainly we'd be interested in all relationships and all the support we can get and the support we could get for these women.
Thank you.
Okay, then that then takes me on to a comment from Pat Kilpatrick. Oh, sorry, I'm going to take Callum Purvis first. Sorry, Callum.
Okay, thank you, Chair. Two questions, if I may. The first one was on well, they're both on the funding, actually. The first one was about the costs that have been outlined, and in the statements at the end, under 2.1 financial implications, it talks about the Scottish Government are considering what and how it should be funded. Does that mean there's a risk that it might not be fully funded and that we or the NHS would have to bear some of that cost?
I don't know if Gordon wants to come in on that. Do you, Gordon?
Yeah, no, I'm happy to come in. So we've had very encouraging feedback from the Scottish Government on the basis of representations that Evelyn and Jane Smith have made in respect of their commitment to consider how that funding might be met. It will be something that I understand the government officials are looking to include in the Scottish Government's budget before the year end. And we are reasonably optimistic that, given those indications, funding will be made available to meet at least some, if not all, of the costs. There's a question about whether the cost of medicine will be met, because that should be able to be being addressed by the NHS board's existing allocations to provide medicines to people who live in their locality. But beyond that, we have a degree of confidence, Councillor Purvis, but you're absolutely correct. We don't have anything definitive. And were it the case that the funding wasn't forthcoming from the Scottish Government, which we might, again expect it should be because it's part of their strategy for managing and supporting female prisoners, it would fall to probably the Health and Social Care Partnership in discussion with the NHS Tayside to meet those costs. And because prison healthcare is a hosted service, we are aware that we've alerted our colleagues in Dundee and Angus that there could be some financial exposure on their part in relation to offsetting the costs of any projected overspend in that budget, should that funding not be forthcoming. So that's the position as we understand it, and we've had recent correspondence in the last 48 hours, so that's probably as up-to-date position as we're able to give at this moment. Thank you.
Okay, thank you for that, Chief Officer. And if perhaps you could keep the board members informed of any updates in that regard, that would be helpful. My second question does relate to that, Chair, if I may, just in terms of if we were to have the cost not being fully funded, how is prison healthcare split at the moment in terms of the funding? Is it based on where prisoners come from in terms of their original local authority, or is it a third? Would we get any money from North Fife if we were having to deal with some of that cost? If you could perhaps just explain how it's dealt with at the moment, please.
Gordon, do you want to do it, or do you want me to do it?
I hope you're more excited on it than I. I mean, I think at the moment the arrangements are that prison healthcare is a third. Yeah, but I mean, I think Councillor Purvis, you're right to recognise that, as the report probably alludes to, that some of the people who would be using this service would be coming from North East Fife, and indeed Jane Smith has raised with colleagues in the Scottish Government the potential that might require us to look to pass on costs to another health board area, which is in itself not without a challenge. It's obviously much easier in the context of working within NHS Tayside, but that becomes a possibility, certainly.
Okay, thank you.
Thank you, Councillor Purvis. These were exactly the same questions I was looking at as well. Thank you so much for that. Now that takes me to comment from Pat Kilpatrick, followed by Jackie Pepper.
Thanks, Chair. Thanks, Evelyn, for the paper, the presentation. I just wanted to say that I commend this. I think it's a great development. There are all the statistics and research shows there are far too many women in custodial care. The law is much harsher on women, and it's therefore much harsher on children and families. I think this is a great development. I fully support it. I think the location's good as well, and right in the heart of a community, whether, I know it's Dundee, but right in the heart of the sort of Strathmartin Coldside area, which I know, and I think it's great, and I think you're doing a great job putting it all together, so well done. Thank you, Chair.
Thank you very much. Jackie Pepper.
Thank you very much, Chair. Just to say something similar to Pat in that the design around this building, I've seen it, is built around a lot of research into what works for women. So it's going to be a state-of-the-art facility. So it's great to have that on our doorstep. But I think we need to recognise that will bring 3 prison facilities within the jurisdiction of NHS Tayside, and 3 within the responsibility of the Health and Social Care Partnership, 2 of which will be national facilities. And I understand that this will be a national facility, in that women will be able to be transferred here from across Scotland, as is Castle Huntly being the top end, whereas Perth Prison predominantly has prisoners from Tayside and into Fife, but they can be elsewhere. So there are differences in the population there. But one positive thing that's probably of interest to the IJB is that the Scottish Sentencing Council approved new sentencing guidelines just last month, which means that with effect from the 26th of January, all courts, and that's 26th of January 2022, all courts for all people appearing for sentencing will have to take account of new guidance for under 25s, which will mean that in terms of deciding the most appropriate sentencing for those offenders will be a presumption against a custodial sentence by virtue of their immaturity or their young age. So what we should see is less young people coming through the prison system and more people engaged in community sentencing. So our criminal justice services, which are not delegated to the IJB in Tayside, are being augmented to be able to manage the additional workload associated with that. So more community disposals and less custodial disposals. So that's a positive, that we'll see less younger people within prison and less younger women within this facility. So that just to take that into account in your planning and for the future. So thanks.
Thank you. That's highly informative, Jackie. Thank you very much. Sarah Dickey.
Thank you very much, Chair, and thank you, Evelyn, for your paper. I really welcome the workforce flexibility described in the paper regarding the flex across all of the custodial establishments, in the hope that that would improve staff satisfaction. I'm therefore wondering if, in addition to staff satisfaction, we're hoping that this will improve the ability to recruit and retain into these positions, recognising the significant contribution required from nursing in the workforce modelling. Thanks.
Yeah, thanks, Sarah. I mean, absolutely that, it's done, designed with that intention, that, it will be an attractive area for people to work. So, in a rotational way, that may just support our ability to recruit and retain staff.
Thank you.
Okay, therefore, in the absence of any further questions and comments, move to the recommendations, and the IGB is asked to note the proposed date of opening for the CCU, which I believe is in June of next year, and note the work ongoing to secure additional funding. Thank you very much indeed. I'd now like to take a break for 10 minutes. That gives us a chance for a coffee, and I'll see you then, and we'll move to update on the redesign of substance use services. Thank you.
It's on. Yes, there's the mic. So the microphone is now working. Okay. Very sensitive.
Welcome, Ian. Bob Benson here.
That off. You're now unmuted.
Hey there, Bob. Bob's on mute.
Hi there, Ian. Welcome. We're are we now live again, please, Val?
Yes, Chair, we remain live. We're ready to go whenever you are.
Okay, thank you very much. We're now going to move on to item 6.3, update on the redesign of substance use services and recovery from COVID in Perth and Kinross. Can you just let us know who's presenting this today?
Yes, certainly, Chair, thanks very much. So I'm just going to pass over to Kenny and Charlie, and they can introduce themselves and then speak to the report. So thank you very much, gents. Nice to see you both.
Thank you, Gordon. My name's Kenny Ogilvie, Vice Chair of the ADP, and this is a joint presentation with my colleague Charlie Cramner, who is the ADP Coordinator. So this is an update on the redesign of substance use services and the ongoing recovery from COVID. 2020 saw the highest ever number of drug deaths in Scotland, unfortunately 34 of whom were from Perth and Kinross. The first 2 quarters of 21-22, the number of people suspected as dying from drugs shows a slightly downward trend, and I emphasise that as suspected for reasons outlined in the paper. It can take a bit of time before deaths are confirmed, but again there is a slight downward trend. Nationally, 2020 saw the highest number of alcohol-related deaths since 2008, and in Perth and Kinross 25 people died due to alcohol, and that was up slightly from 2019. And there has been a significant increase in referrals for people seeking support with alcohol-related issues over the past year. During the pandemic, substance use services had to amend the way we delivered services and support, and that included setting up virtual assessment clinics and recovery cafes, implementing post-on-naloxone and injecting equipment, and also developing a delivery service for opiate substitute prescriptions for people who couldn't get to the pharmacist, primarily because they were shielding or unable to leave the house. That said, face-to-face services have fully resumed. However, virtual supports are still available for people who prefer it. Over the last number of months, new monies have become available through the National Mission to Reduce Drug Deaths in Scotland, and there are 3 key areas. The first is to improve access to residential rehab, second is faster access to treatment, and the third, implementing the whole family approach framework. And there's also funding to support the implementation of medication-assisted treatment standards. And they are national standards which basically cover a range of things from timescales to a range of treatments, etc., and supports that should be available in every area in Scotland. The integration of substance use services is ongoing. I think last time we presented a paper, we talked about how the old health substance misuse service was integrating with the social worker drug and alcohol team to form the integrated drug and alcohol recovery team. That is ongoing. We have used some of the new monies to increase capacity in the team, and we are now having more recovery workers and more substance use nurses. And again, this increased capacity is helping us implement a new model of working with an emphasis on recovery. And funding has also been used to get an occupational therapy post for the team. We're also in the process of recruiting a social worker for the team with mental health experience, and also an assistant psychologist. And even just an assistant psychologist post, previously, if the psychologist, of which there is one in Perth and Kinross who supports folk with substance use issues, if she wanted to undergo any group work with people, she had to get a colleague from Angus or Dundee to come in to support with that. Obviously, now we have the assistant psychologist. That means we can run the groups just using Perth and Kinross capacity. Obviously, that cuts down on travel time, etc. So that will significantly increase access to psychology support for people in Perth and Kinross. And this complements the ongoing development of the multi-agency assessment clinic, which we've mentioned previously, and that consists of statutory and third sector reps and improves access to appropriate supports for people when they require it. In May 2021, we introduced the non-fatal overdose pathway in Perth and Kinross, and this consists of Scottish Ambulance Service, the police, public health and statutory and third sector substance use organisation reps, and this is linked to the multi-agency assessment clinic. And again, we've used some of our extra funding to recruit a third assertive outreach worker. So we now have an assertive outreach worker for each of the 3 localities in Perth and Kinross. And again, if someone is flagged up as having a non-fatal overdose, if they have a key worker from a substance use service, that worker is informed and they make immediate contact. For people who don't have a current worker, that's where the assertive outreach workers come in and they get their details and go out and actually try to make physical face-to-face contact with them as soon as possible. And I'll now hand over to Charlie.
Thanks, Kenny. We're looking to enhance another 4 key areas of work as outlined in the paper, and I'll just very briefly run over some of the key aspects there. Residential rehabilitation, we've revised our process for considering referrals, so a new process has now been implemented. And we're also, very importantly, reviewing and improving support for people when they return to the community once they've completed rehab, as that's been an area of real concern in the past. We're looking at our grassroots recovery communities. We were delighted in Perth and Kinross to host the 2021 Recovery Walk Scotland. That took place in September. The event was a real success, and we're hoping to build on the success of that event by implementing our 3-year plan to develop our grassroots community recovery community in Perth and Kinross. And we're going to do that by supporting 2 new posts, 2 new recovery posts, 1 in the community and 1 in conjunction with HMP Perth. We also intend to establish our lived experience reference group. This was something that we'd hoped to do previously, but unfortunately, as a result of the pandemic, we had to put those plans on hold. However, we hope to establish that group as early as possible in 2022. Our third area of work is our whole family approach. There's a couple of areas that we're focusing on for that. We've put some funding towards a new social work post, which will help to embed our whole family approach across Perth and Kinross. And we're also running a test of change with a small number of families locally to develop a joint plan, which will see services working together to try and provide appropriate supports to those families. And finally, a key area of work is alcohol. There's a number of different strands of work that we're supporting concerning alcohol. We've provided additional funding to Tayside Council for alcohol for additional counselling. We're part of a pan-Tayside approach to employ a new alcohol brief intervention coordinator to ensure that the rollout of alcohol brief interventions continues. That's something that had been going well, and unfortunately took a bit of a hit as a result of the pandemic, but we'd hope that that can pick up the pace again in 2022 with the new coordinator in post. And we're also providing funding for a new community alcohol detox service, and recruitment for that service is underway at the moment. So as the paper outlines, there's a lot of different strands of work in a lot of different areas, and the funding that we've been given from the Scottish Government, we've tried to use that across all these different areas to enhance the support that we can provide. In addition to these enhancements, the paper also outlines 2 or 3 other relevant developments for the ADP. Our annual report was submitted recently, and that's an appendix to the main report that you have in front of you. The annual report covers the period April 20 to March 21, so very much concerns the response to the pandemic. Our delivery plan is a 3-year delivery plan. Progress in the delivery plan was paused as a result of the pandemic. I think that was an appropriate thing to do. However, as we hopefully move out of the pandemic, then we'll be looking to pick up pace again with our delivery plan, and our ADP strategy group will be receiving regular updates on progress as we look to deliver that. Concerning governance, there's been a number of developments nationally for governance of ADPs, the most prominent of which is the Scottish Government COSLA supported Partnership Delivery Framework. This looks to ensure that all ADPs have clear strategies and plans in place, have transparent financial arrangements, have robust quality improvement arrangements and effective governance. The Partnership Delivery Framework will be implemented in April 22. However, Perth and Kinross ADP already have a number of these recommendations and suggestions in place, and we're confident that we can meet the rest for implementation in April. The final part of the paper outlines a couple of elements of performance, particularly the MAT standards, as Kenny already mentioned, so the medication assisted treatment standards. The new national MAT standards are due to be implemented in April 22 and focus on reducing harm and promoting recovery. And Perth and Kinross, the ADP, is working very closely with the MAT standards implementation team of the Scottish Government, the MIST team, to ensure that we can meet all the standards and have everything in place by April 22. So in conclusion, as you can see, and as you've hopefully read, there's a lot going on. The main focus of the ADP is to resume delivery of our strategic priorities. There's significant investment being put in place to enhance work in a number of areas, for example, IDART, our non-fatal overdose pathway, our recovery communities, and our residential rehab work. All looking to try and ensure that people affected with substance use and their families get the support that they need as they start and continue their recovery journeys. Thank you.
Thank you very much indeed, and a very interesting report as well. I'm now ready to take questions and comments, please. Okay, Pat Kilpatrick and Beth Hamilton.
Hi, thank you to Kenny and Charlie for taking us through the paper. And does this part of the agenda include the appendixes that were part of this, appendixes that discuss residential rehab and naloxone treatment and all of that? Yes, is this the right part of the agenda?
Yes, yes.
Right, okay, just so I'm not asking you that, I'm not taking it out of sync. So I thought it was really good, thought the paper was really good, and obviously you've made a lot of progress in a number of areas. I've got a number of questions. One was rehab placements. You talk a little bit about custody to rehab and rehabilitation for those people that are going through home detention curfew scheme. Is there a big demand for people who are not in the custodial justice system to access residential rehab? And do we have sufficient numbers? And where does that rehab happen, and who provides it?
There are a range of providers for residential rehab across Scotland, and certainly what we're doing together is working with Scottish Recovery Consortium, who are part of national discussions regarding residential rehab, and gathering a list of the various organisations providing it across the country. So yes, there is a demand. We have had a couple of requests that have come in for residential rehab since the monies were awarded by the Scottish Government. And certainly we have been in discussion with our colleagues in Perth Prison, and they are certainly flagging up that there is potential demand there as well. So again, we have developed protocols and procedures to screen and make sure requests for residential rehab are assessed and authorised as timely as possible.
Okay, thank you for that. And I just, without labouring the point, when we talked before about joint protocols between substance use and mental health services, do you think you can give us a date when you think that might be a reality? Because, you know, people come back to this committee and they say, oh, we're doing this and we're doing that, and that's great, and we take that at face value. But it would be quite good, Chair, I think, if we could get an indicative timescale as to what, given this was a strong recommendation and it's been profiled in so many different forums. If we could get an indicative date, if you could do that, Kenny or Charlie, to give us an indicative date of when you think this pathway will actually be in place. So I think I'm competing with somebody's dog.
Yeah, I mean, we can. I think it's important just to clarify that, you know, there certainly is joint working arrangements in place at the moment. I think I mentioned in the previous section, hopefully give reassurance that the strategies were interlinked. And certainly what I should have added to the last comment I made regarding the strategies is we have got our business improvement lead for both strategies is the same person. So he works across mental health and substance use. So, you know, there's that strategic link. I mean, operationally, we have obviously got locality working in Perth and Kinross. And we've got the 3 localities and the 6 sub-localities. And in the localities, there are regular integrated team meetings. So you will get workers from, for example, a mental health team, a substance use team, an older persons team sitting together. And, you know, if there are people with dual diagnoses or multiple diagnoses, they are discussing those settings. So there already are mechanisms in place. What we potentially have to do is just firm up the arrangements, probably between the specialist mental health, the community mental health teams and the substance use team. But there is certainly a work stream, a Tayside-wide work stream in terms of the Tayside mental health strategy focusing on this. And Charlie actually sits on that work stream. I don't know if Charlie wants to come in regarding that.
Yes, I was just going to say, so I'm part of the delivery group for the Health Improvement Scotland Pathfinder project,
right,
which is looking at
delivery. That's what we want. We want delivery, Charlie.
Yeah, no, that's it. So I sit on that group, and the project's looking at developing better pathways for people with dual diagnosis. Originally, the project was just looking at Dundee, but it's been, I think, correctly extended to look at Perth and Kinross and Angus. Now, the project at the moment has been gathering evidence, it's been speaking to patients, it's been speaking to professionals and other members of staff, and the delivery group are just waiting on the report to come back, which has gathered all that evidence to look at the recommendations. Stage 2 of the project is then to obviously have a look at what we can do with that evidence and how we can actually look to build enhanced pathways. The project's gathering a lot of interest actually, and although it started in Tayside, my understanding is that similar models are now going to be looked at across other health boards, and they're going to try and do the same thing. The project's due to report this year. I don't have a date for you at the moment, and I think we were waiting to see how long it was going to take to gather the evidence. There's been some problems again because of the pandemic, and things were somewhat delayed. But I would certainly hope that we can make progress, you know, as soon as possible when we come into the new year. And I would certainly hope that, you know, over the next few months we can really start to see some developments in that project. But it's a new project, and it's an exciting project. You know, I think it has the potential to really deliver something really worthwhile. So it's something that I'm sure you'll be hearing more about over time as well.
Absolutely, thank you for that. Could I suggest, Chair, that we, as an action point, we bring that back in the new year at some point? And my last question, if I may, if you will indulge me, Chair, is about the distribution and use of naloxone. Now, after the Lord Advocate made his ruling on who is a suitable, but the fact that lots of people could store it and be trained to administer it, and that there would be no prosecution for that. I saw from your return that said that homelessness, GPs, family support services and mental health services do not supply naloxone, and I just wondered why that was, and would they not be suitable candidates for that sort of provision? But I don't have a substance use background, so I'm not entrenched in this. I'm just trying to understand that.
I mean, yes, they would, is the short answer to your question. I think historically what's put some people or some organisations off being holders of naloxone is it's been an injection, but they now have naloxone sprays which are now being introduced. Right. So hopefully that will increase the number of organisations and individuals willing to hold that. So it could be particularly useful in nasal as well, you know, family members and the wider public as well. So we're hoping that will be introduced in the next few weeks. That said, you know, we have managed, I think, since that comment was made, to expand the numbers of people, and there's currently 6 non-drug treatment services supplying naloxone in Perth and Kinross. So we have got 6 at the moment. We're hoping the introduction of the nasal naloxone will significantly increase that further. Right. And there's also a new community pharmacy substance use service contract. So again, all pharmacies will hold a supply of naloxone under that for use in an emergency, and they can potentially supply kits to people as well. So again, that should help increase the use of that. And I think it's just worth mentioning here, just in the last few weeks, there was an example of 2 of our community wardens actually came across a person who had a suspected overdose. And they managed to administer naloxone and basically saved the person's life.
He was very proud of you. He cited your example. So that's a great kind of you know, that's a great recognition, isn't it?
Thank you, Pat. So, yes. That was a question and a comment at the end as well. Thank you, Pat. I'm sure.
Can I say thank you to Kenny and Charlie for answering the questions? I appreciate that. Thank you.
Thank you very much indeed. I'm now going to move on to Beth Hamilton, and before I do that, I'm mindful of your action point on that, and we certainly will be looking for some update on that anyway. We have a formal update anyway in 6 months' time, when we might need to look at how we would do this both at board and perhaps at development level as well. Thank you, Beth.
Thank you very much. And can I just say, Kenny and Charlie, well done. It was pretty comprehensive and particularly helpful to see the 2 appendices. I suppose my questions, the first one is, well done in getting all the funding for all these additional posts. How are we progressing in recruitment, and are there people out there to fill these posts, is my first question. The second one, I was wondering about particularly the group, the family support, etc. There's nothing really mentioned about the challenges around stigma for this group of people, and particularly the stigma impact on families and particularly children and support. I just wondered if that was anything we'd be looking at in the future. So that was my 2 questions. Thanks.
Thanks. Yes, I mean, recruitment is an ongoing issue, especially in the current climate, and we are competing with a lot of alternative areas. That said, I think we've been pretty quick off the mark in getting our recruitment processes underway. So yeah, I mean, certainly in terms of our recovery worker recruitment, that's going okay. Nurses is more of a challenge, but again, what we're trying to do is sell the service as a whole, and obviously the increased capacity, new model of working hopefully makes Perth and Kinross an attractive people who have a nursing qualification or are interested in working in the substance use area. Hopefully that will attract them to come in. And you know, things like the assistant psychology post, that is a brand new post, and our psychologists are actually advertising that through psychology specific networks there, and I believe the initial response has been reasonable to that, so they're certainly confident of recruiting to that post. In terms of stigma, It's, the Drug Deaths Task Force Dundee Commission did specifically mention stigma, and there are a number of actions underway to try and address that. But again, the extra capacity have with our social worker, working with families and introducing the whole family approach can support that. I don't know if Charlie's got anything further to say on addressing stigma.
The one other thing I was going to say was just around recruitment, actually, Kenny. It was just to say that we've also had a discussion with the Scottish Government support team for MAT standards to ask if they can maybe at a national level do some campaign or to do some work around recruitment to substance use services, given that recruitment in general is around the country is a bit of an issue. So we've raised it at government level to see if there's anything maybe they can do to help out as well and take on the challenge that we all face at the moment with recruitment.
Okay, thank you very much indeed. Sandy Watts.
Thank you, Chair. If I could come back to the point that Patricia Kilpatrick made, please. We again discussed this at the Third Sector Forum yesterday around the residential rehabilitation, and we weren't aware that there was any additional provision currently being offered, and I wondered if that could be confirmed and whether it's possible to provide any clarification on how the new revised process is actually going to work. Presumably with increased demand and no extra provision, the challenges must be quite great.
I mean, again, certainly in terms of residential rehab, it's increased funding that we've received to pay for residential rehab placements. And again, we are tapped into national discussions regarding identifying all the provision that is out there nationally. In terms of the process for people accessing it, they can do that through any of the substance use agencies in Perth and Kinross, who then can make a referral on their behalf. They can do it through their GP, they can do it through health professionals, they can do it through the access team, the social work intake team.
Thank you. That's very helpful.
I mean, again, if you're looking for more information or you want us to come along to any of your meetings, please let us know. We're more than happy to do that.
Oh, that would be brilliant. Thank you.
Thank you very much indeed, and thank you very much for that kind offer as well. Are there any further questions for Kenny and Charlie? If not, I'd like to thank you both for providing such a stimulating range of questions. It's an excellent paper, and I look forward to the update in 6 months' time. And just to reiterate that we note the actions that have been taken regarding the remobilisation of substance use and substance use services, and we note the progress in the redesign of substance use services, and we note the proposals for spend of national mission monies. And we look forward to that update. And I'm speaking to Gordon now, we might want to consider a combination of board and or stroke development session or whatever, or both, when we come to that point, because there's quite a lot of discussion in this fairly critical issue for us. Thank you very much indeed. Very positive stuff in the chat as well. Thank you very much indeed, greatly appreciate that, and we'll see you again soon. Bye-bye. Now, we move now on to the 6.4 strategic planning group. 6.41 is the minute of the meeting of the strategic planning group on the 31st of August. And I understand there's been a further meeting since then. Gordon, do you want to say anything before we look at this?
Yeah, so this is the formal minute of the meeting of the 31st of August. I think at the last IGB we indicated that this meeting was going to be going ahead, and we have also got the opportunity to provide through Zoe Robertson an update on the meeting that took place much more recently, for which we don't yet have the minute. So I'll hand over to Zoe to talk about the more recent strategic planning group meeting. Thanks, Zoe.
So the most recent SPG was held on the 23rd, and we discussed the Learning Disability and Autism Delivery Plan,
That included our work in relation to SCOPE, which is our new complex care multidisciplinary team, our overnight responder plans, day and respite opportunities, transitions, positive behavioural support and our work in relation to that, and our core and cluster models. There followed a discussion raised by Perth Autism Support with specific regard to those with an autism spectrum condition and the definition of complex needs and whether this definition encapsulated that group. The discussion highlighted a need for us to acknowledge this group of individuals, particularly those that are termed as having a high functioning condition. It also discussed that several of our strategies support this group and that it didn't just sit within that complex care transformation programme. Our links with CAMS service was also discussed and how we improved transitional work with input from Support in Mind, one of our commissioned third sector organisations, and some work they're undertaking in relation to support pre and post-diagnostically with young people. We presented on the older people strategic delivery plan, and that included our work in relation to increasing need, frailty and complexity, our local integrated teams and our re-ablement approach, the investment in advanced nurse practitioner roles, interim bed placements and enhanced evening and overnight services. There followed a discussion in relation to the use of intermediate care and then dementia and existing resources, the potential for further developments in relation to the third sector, investment and training, and Alzheimer's Scotland mentioned their plans to open a day centre and develop their brain health approach locally. Chris came and talked about the mental health and wellbeing strategic direction and priorities, which you'll be familiar with, but suicide awareness, investment in mental health advanced nurse practitioners, connected compassionate support, crisis and distress model, mental health and wellbeing hub proposal and a resilient and sustainable workforce. The discussion included an update on the community mental wellbeing funding that's being distributed via PCAFs to third and community services, and there was clarification on the purpose of the Action 15 monies and how this funding was being used. And finally, we presented on our draft market facilitation plan, which addressed areas of need and potential development in line with our strategic commissioning plans and 3-year development plans that we previously presented on. So we discussed strategy areas including communities, older people, carers, tech, mental health, substance use, complex care, autism and learning disabilities. A wide range of developments were presented and the group were asked to reflect and come back to us with their thoughts. And we are sending out a PowerPoint presentation for them to have more opportunity to analyse that and to contribute to those developments as we move forward. And the next meeting is due, I think, early February next year.
Well, thank you very much indeed, Zoe. Are there any questions about the minute and about the update? No, there doesn't appear to be. So we'll just note that minute and for the update. Thank you very much indeed. And we'll now move on to Zoe, is there something you want to add into this? Oh, 25th.
Yes, sorry, the wrong date I gave you, 25th of January for the next meeting.
Thank you very much indeed. We now move on to the strategic planning update 6.411, and it's a verbal update by the interim head. Who's going to speak to this?
Sorry, that's the item that we've just dealt with, Bob. That was Zoe's item.
Oh, is that the same again, was it? Right, I see. Right, okay, thank you. So we've already addressed finance and budget update earlier on to enable Jane to leave earlier. That now takes us on to item 8 for information, which is 8.1, equality outcomes and mainstreaming report. And Gordon, do you wish to kick this one off?
I wasn't really going to say very much about this. This is really for information. I don't know if IGB members have got any particular queries or concerns about it. The report reviews the IGB's agreed equality outcomes in light of the publication by both statutory partners of their equality outcome and mainstream reports. And it shows the map, the read across between the IGB's equality outcomes and identifies some of the actions that are being advanced in relation to both statutory partners in pursuance of those equality outcomes. So I wasn't going to go into any more detail than that, Bob, if members have got any questions.
Thank you very much indeed. That's great. Any questions? Well, in the absence of questions or comments, we'll just note the recommendations, the strong basis for continuing joint equalities activity, and notes the continuation of the existing 5 IJB equality outcomes, and further notes that reports will continue to be submitted to the board on an annual basis in relation to progress in response to these equality outcomes. Thank you very much indeed, and thank you to the authors of the report too. Thank you. That now takes us on to, and I'm having to scroll down here, bear with me, which is the Integration Joint Board Reporting Forward Planner 21-22. And do we have any particular comments on this? Okay. What I was going to say was, I actually had, just in relation to this reporting forward planning and agenda items, I had a very useful discussion with public partners last week, in fact, and it made me think a lot on reflection about the agenda thinking that we should also be considering. And I'm going to consider further on that with the Chief Officer when I meet the group again in about a couple of months' time. But I'm very taken by the kind of input of service user experience, in fact. And I think that was particularly drawn to me by the children and young people presentation this morning for elected representatives and how powerful that could be, and maybe look at how we do a bit more of this, setting agendas within not just our formal board sessions, but also our development sessions as well. So I'm giving that further consideration. I want to thank all of the public partners for their involvement in that discussion. So I want to then just bring to your attention item 9, the proposed IJB meeting dates. You'll notice there was an amendment from the first to the second iteration of that paper, and the development session dates as well. Okay, further to that, there is no formal other business today, so I will now bring the meeting to a close. Thank you.
Thank you.